Welcome back, Tigers. We are today going to be focusing on stress. And stress is something that everyone in our world goes through. And to get us into the topic, I have a short trailer from a documentary that HBO put on called One Nation Under Stress. So enjoy. So you can see from that trailer that feeling stress is a very natural part of life. It's something that everybody feels mostly every day to some degree, and it can have some unintended consequences for society and for our lives. That's why we talk about it in health. So stress is the reaction of the body to everyday challenges and demands. It may appear quickly, like when you're running late or running to catch the bus, but it can also slowly build for days, like when finals exams happen. If you think about that event, right, you know it's coming, but your stress level far away from that event would be pretty low. But as we get closer and closer to that day, it builds up and peaking at that final exam time. So it does slowly build up for days as well. A stressor is anything that causes stress. And stressors can range from everyday annoyances to serious personal problems. They can be people, objects, places, events, and situations. And they affect people in different ways. A person can feel nervous, for example, about auditioning for the choir, but their friend might find that same situation very exhilarating and exciting. So how stress affects us will also determine how we react to it. But the bottom line is how much a stressful event affects you or how much stress you feel when a particular event occurs depends on your perception of it or how your senses become aware of the situation. Essentially, it's how you view that situation. So, for example, based on your perception, you might believe an argument with a friend has ruined your relationship. However, your friend may believe you'll eventually work it out. So, based on how you view that situation or your perception of the event, you will feel a higher level of stress about that situation than your friend would. But not all stress is necessarily bad. Positive stress is called eustress, and this type of stress can make life more pleasurable because it can help you reach your goals and motivate you to do your best. For example, it may help you find the energy to study for a test and feel prepared, or train for a game, tournament, or race day. But we do experience negative stress, which is called distress. A person may react to this type of stress by having an upset stomach before giving a report or by losing sleep after arguing with a friend. And we can't always avoid this type of stress, but we can learn to manage it. And it's important that we do develop skills and strategies to manage our distress because this type of stress can be unhealthy. It's actually harmful to the body because it causes an increase in cortisol, which is a steroid hormone that is responsible for a wide range of processes throughout our body, including how we digest our food and our immune response. And we'll talk about what effects on our body high cortisol levels have in a couple of slides. When a person perceives something to be dangerous, difficult, or painful, their body automatically begins a stress response. For example, if you have ever had somebody jump out at you from behind a wall and you didn't know they were there, you would likely feel startled and your heart might start racing. The sudden event is a stressor that affects you automatically without even thinking about it. So both the nervous system or the brain and the endocrine system, which is the body system that regulates all of our hormones, are active during the body's response to stress. They are responsible for triggering that fight or flight response. This response is regulated by the hypothalamus, which is located in the very center of our brain. That hypothalamus receives a danger signal from other parts of the brain and releases hormones, or a chemical, to the pituitary gland located at the base of the brain. The pituitary gland secretes a hormone that activates the adrenal glands, which are located right on top of our kidneys. The adrenal glands produce two hormones, adrenaline and cortisol. As I said before, cortisol is a steroid hormone that is responsible for a wide range of processes throughout our body, including how we digest our food and our immune response. It's released during that fight or flight response and is considered the main stress hormone. When a stressful event first happens, the body amps itself up in order to put it on high alert and produce extra energy it will need to fight or run away. So think about when you have a stressful event. Again, I'm going to use that public speaking example because that is something that a lot of people can relate to. Think about how your body feels when you go through that event. Are you sweating a little bit more? Does your heart start beating a little bit faster? Do you start breathing a little bit faster as well? All of those are those reactions that our body naturally does in response to this stress. So it's part of that fight or flight response. And the reason we feel these symptoms is because of the release of adrenaline by the adrenal glands. So adrenaline causes dilated pupils, an increase in perspiration, a faster heart rate and pulse, rise in blood pressure, so our blood is pumping through our veins a little faster, a faster breathing or respiration rate. Our arteries will narrow to our internal organs and skin because we don't need those organs like our stomach or intestines to fight off something that is potentially stressing us, but we do need an increased blood flow to muscles and brain because that's what we're going to need to either fight or flee. There is also an increase in muscle tension and release of blood sugar, fats, and cholesterol because those three things give us extra energy. So it's essentially giving our body extra sugar to burn in order to fight off the stressor or run away from it. Now, the stress we experience can either last for a short amount of time or it can last for a long time. That immediate reaction to stress is known as acute stress. Another way of thinking about this is short-term stress. This is where a person is going to experience that fight or flight response. So their breathing's going to increase, their heart rate's going to increase, they're going to start sweating more, their pupils are going to dilate, right? All of those immediate physical symptoms come from acute stress. But once that stressor goes away or once that threat passes, that level of stress hormone, cortisol, and adrenaline decrease. So the stress essentially goes away. Chronic stress is that long-term stress, and if unmanaged, high levels of cortisol build up in the body and causes a lot of health problems for the mind and body. So this is the type of stress that we really need to look out for. Cortisol is a naturally occurring hormone in our bodies that fluctuates during the course of the day along with our circadian rhythms. So our levels of cortisol change as we go through our sleep cycles and are awake and sleeping during the day or at night. So in the morning when we wake up, cortisol levels are at their highest because cortisol is one of those hormones that helps wake us up in the morning. As the day goes on, our cortisol levels should gradually decline until they hit a low point at about 8 to 10 p.m. That allows us to go back to sleep at night or to fall asleep at night. They stay relatively low during our deep sleep, but gradually begin to increase around 4 to 6 a.m. until we wake up. However, stress can greatly affect the way our cortisol levels change and how it's produced and secreted in our body. And this results in significant changes in our sleep cycles. It also has lots of negative effects on our body. High levels of cortisol greatly affects our heart. It causes our blood vessels to constrict, meaning that there's less space or less room for our blood to travel through our arteries and veins, which makes it harder for the heart to pump blood. Our heart actually has to work harder to pump our blood through our body. High levels of cortisol also release fatty acids and plaque that build up in the bloodstream and are responsible for causing heart disease because those fatty acids and that plaque attach themselves onto those artery and vein walls, making that space for blood to travel even smaller, and could actually block the artery's pathway altogether. High cortisol levels also have a negative effect on our adrenal glands. Estrogen, progesterone, and testosterone, which are the reproductive hormones, all decrease. Our metabolism also decreases. Metabolism is how fast we burn calories or how fast we use the energy that the food we eat gives us. So, as a result of burning calories slower, it causes weight gain. High cortisol levels also cause higher rates of depression, acne, and fatigue, or it makes us really tired. We can experience physical weakness. Our immune system is suppressed, so we cannot fight off bacteria and viruses that we normally would be able to, like the flu. And it can also cause a lot of skin problems and anxiety. Increased cortisol levels as a result of chronic stress or stress we experience over a longer period of time has negative consequences for the brain as well. The hippocampus, which on that picture on the right, you can see that green area in the middle of the brain, that is responsible for learning and memory. So, as a result of these high levels of cortisol due to stressful events that we experience over a long period of time, it makes it harder for us to learn new things and remember them. The frontal lobe is another part of the brain that is affected by high levels of cortisol. This is that purplish, very front of the brain that you can see on the picture on the right. This is where our decision-making skills or abilities are housed. So when these high levels of cortisol happen, those decision-making skills are affected. It's harder to make good decisions when we are experiencing a stressful event over a longer period of time. And lastly, dopamine and serotonin are also affected. These are neurotransmitters or chemical messengers that deliver messages in our brain to different parts of our brain. They're responsible for delivering messages that involve our feelings of happiness and calming. So they actually help to regulate our mood and our emotions. So when we experience high levels of cortisol, those do not get delivered. Those messages don't get delivered as well, which increases our rates of depression and anxiety, or decreases those feelings in a person. Lastly, high levels of cortisol can have negative effects on the liver. The liver produces excess glucose or blood sugar, which we use for energy. So if we have too much sugar in our blood, it causes a lot of health problems, like an increased chance of developing type 2 diabetes or weight gain. And weight gain, or holding on to body fat longer, especially that abdominal fat or the fat that is in our stomach region or our lower abdomen, that's going to have negative effects and cause a lot of different health problems as well, like heart disease, cancer, and a higher risk of stroke. So we know all these negative effects can happen to our bodies and our brains as a result of stress, but how do we avoid, or how do we manage these feelings? I will tell you that some people use alcohol and drugs to relieve their stress. This is not a good coping mechanism and may create more problems if a person begins abusing these substances. The easiest way to reduce the effects of stress is avoiding situations that cause us stress in the first place. We can do this by saying no to stressful situations, or saying no to situations that's going to add more to our plate. We can plan ahead and manage our time wisely. And we can think positively. We can't control everything in our lives, but we can control how we respond to events. So if we shift our perception or how we view a stressful situation, we're also going to react to that stressor in a different way. And then avoiding tobacco, alcohol, and other drugs is another way to limit the stress that we feel. But some stressors are unavoidable. So for stressors that you can't avoid, try to find ways to reduce their negative effects. These could be strategies or skills like practicing relaxation techniques, such as deep breathing, thinking positive thoughts, or stretching, or even laughing. Laughing is a great relaxation technique that helps relieve the stress that we feel. We can redirect our energy and put it into something more productive, like working on a project, going for a walk or a swim, jogging, playing a pickup game of basketball. And we can also seek support. Sometimes we just need to talk about how we're feeling and what things are making us stressed in order to feel better. So try confiding in someone you trust, like a parent, guardian, sibling, teacher, or close friend. They can also provide you with an objective view and some valuable advice for your situation. In addition to stress management skills, we can also develop habits that maintain our general health and will also help us deal with stress in a positive way. So it plays a role in preventing stress, reducing stress, and helping our mind and body recover from stress. So some tips you can use to help manage your stress include getting enough sleep. I cannot tell you enough how much sleep affects all aspects of your health, because you really need to give your body time to rest and recharge to deal with what's going to happen in the next day. Too little sleep can affect your ability to concentrate, but getting enough sleep can help you face the challenges and demands of the next day. So make sure you're using those time management skills to get your 9 to 10 hours of sleep that you need each night. Getting regular physical activity is another great thing we can do for our overall health, but it also helps us deal with stress. Physical activity can release the pent-up energy that we gain from that fight or flight response, and it can also help to clear your mind and help you think more clearly. If it's done on the regular, so if it's done on a regular basis, exercise actually increases your energy level and endurance, which means that number one, you have more energy to deal with the stressors that occur throughout your day, but it also helps you sleep better too, right? When we're tired, when we have extended all of our energy throughout the day, we're gonna be able to fall asleep a lot easier. And lastly, eat nutritious foods. Having a balanced diet and drinking enough water reduces the effects of stress. On the flip side, or in contrast, poor eating habits can actually contribute to stress, causing some negative effects for us to feel, like weakness, fatigue, and our reduced ability to concentrate. It's especially important to stay away from beverages that are high in caffeine and sugar, like coffee drinks. And I know that's really difficult. I am a coffee drinker. I'm the same way. But staying away from things that have caffeine in them actually will decrease those levels of stress, because caffeine is one of those drugs that makes those effects worse. So as we are wrapping up this discussion of stress, it's really important that you guys understand what stress is and how it affects our body when we don't take active steps to help manage it. Because it's not something that just affects our mental health, even though that's the unit we're discussing it in, but it does affect our whole health triangle, our physical health and our social health. So if we can include those self-maintenance and stress management strategies that we just went over into our daily routines, right, developing those positive lifestyle habits, we're going to be able to become more resilient. So this means if we have a higher degree of resiliency, we're going to be able to adapt more effectively and recover from any disappointment, difficulty, or crisis that a stressor brings. Resiliency will help us handle any difficulties or challenges in healthful ways. So all parts of our health triangle are going to be affected in a positive way. And ultimately, we're going to be able to achieve long-term success in spite of negative circumstances that may occur in our life. So again, it's really important that we know how to manage our stress and to develop healthy coping skills or stress management strategies into our daily routines to deal with them. So think about how you deal with stress and what strategies you either are currently using to manage your stress, or what could you incorporate into your daily routine so that you are able to become more resilient.